than just a doctor, more than his own personal gains. The personality whose efforts founded Kumi Orthopedic Center has brought us on a journey to Kumi district. And as we continue with this journey, for you to meet Dr. John Ekure, think about this. Strive to be known for that which is good in the world, for it will give you more than what wickedness does. After all, wickedness will never reign over what is good. People and power. My name is Mebo Twegumiezake, and this episode belongs to Dr. John Ekure, an orthopedic surgeon and the director, Kumi Orthopedic Center. Let's continue. This is how his story began. An intern doctor at Mbarara University of Science and Technology in 1997 to 1998, Dr. John Ekure's practice led him to Kumi Hospital in 1998 to 2001 as a medical officer. A senior house officer at Mulago Hospital Department of Orthopedics in 2001 to 2004, he later returned to Kumi Hospital and Soroti Hospital as an orthopedic surgeon in 2004 to 2010. His purpose was revealed as the architect of Kumi Orthopedic Center since 2011 to date. People and power.
Dr. Ekure's achievement is a very, very encouraging and a very best thing we have ever had in Teso, which has helped the whole of Uganda by taking up a special profession, because he really wanted to help people who had difficulty in walking, especially when you are lame. It's very uncomfortable. And because his mom was like that, he really put his heart to love people and do what exactly felt was good and made him happy, and also to remember his mom.
He has love for his patients. You will come here at 7:30 and you'll find Dr. Ekure in this hospital. You will come here after 5. He has still come to check on his patients. And that is the heart that I believe most of the doctors should be owning or giving to people.
When he was in the school, he told me that I want to go and become a doctor like you people, because his mother also was a nurse. So we encouraged him to go. And he said, after that, I want to specialize in bones. He became orthopedic what? Doctor. After that, he said, I will not take my hospital somewhere because I'm born where? Teso. So he brought his hospital in Teso.
He has done a lot for the area, for the people, and for Uganda. As far as orthopedic rehabilitation, treatment, and management is concerned.
People and power. This episode belongs to Dr. John Ekure, an orthopedic surgeon and director, Kumi Orthopedic Center. Welcome to People and Power.
Thank you.
Okay, so you invested in a multi-million orthopedic center. Are you a billionaire?
I would have to say I invested in a multi-billion orthopedic center.
Yeah.
Yes.
I can actually do that again.
Yes.
So it's a maybe by the time it started it was multi-million, right?
You're right.
So now it's multi-billion.
Yes.
So are you a billionaire?
No. It's a story of starting brick by brick and living one day at a time. Cumulatively, it's billions. Yes.
And I can't wait to get into that story. But for our viewers, maybe you should draw us into what orthopedics entails.
Orthopedics is the science or the medicine that deals with the musculoskeletal system. It is what makes you be able to walk, sit, stand, and do many things. It's about part of the body that keeps you upright or keeps you moving, your limbs, your spine, your legs, your hands. Because if I talk about limbs, some people may not know about limbs, but I'm just talking about your hands, your legs, and your back. That's what we deal with in orthopedics.
Okay.
Yeah.
So how is it pertinent in Uganda's health system?
It is pertinent because we have a lot of trauma in Uganda. We know about border accidents that have maimed lots of our population. They have actually killed many people, but there are also those who are unlucky to just get broken bones. Then the Ugandan population is also aging. People are having issues with their backs. People are having issues with their joints, especially the knees and the hips and the shoulder joints. And then there are children who are born with deformities. That's part of orthopedics as well. And there are children who are unfortunate to get infections. Not just only children, but even adults. So orthopedics is a very wide field of medicine.
Okay.
Yeah.
If it's a very wide field of medicine, does that mean it also has facets, like there are facets within orthopedics? Because I was going to ask what category of a patient would need an orthopedic, because you are a specialist.
Yes.
Yeah? So talk to us
Yes,
about
orthopedics has facets. There is orthopedics that deals with children's musculoskeletal system, the ones who are born with club feet, the ones who are born with either knock knees or bowed knees, the ones who are born without limbs, the ones who have maybe who are born with the other deformities altogether in the spine or any other part of the body. Then as they grow up, they can get infections, they can get tumors. Tumors, I mean cancers, that can also be dealt by the orthopedic surgeons. Then adolescents also have their own issues, orthopedic issues. And then when they grow up to be young adults, they also have their own orthopedic issues. As they age, all of them have orthopedic issues because most of them, or all of them, end up with worn out joints, worn out backs, with lots of back pain, and some of them may be work-related conditions. So orthopedics is full of, there are so many facets.
Okay.
There is spine surgery, there is trauma surgery, there is arthroplasty, there is tumor orthopedic oncology, dealing with people who have had cancers affecting their musculoskeletal system that can be dealt with. The surgery may involve removing the cancer and replacing it with a prosthesis.
Okay.
That is also there.
And where do you fall?
I fall in all of them.
You fall in all?
You see where I am?
Yeah?
I am in Kumi.
Yes.
Kumi is not one of the luckiest towns in Uganda.
Yeah.
It's one of the most economically depressed areas, and it's for a reason that I'm in Kumi. When I qualified from my training, I decided to move away from Kampala because I wanted something new and something separate that would benefit the rest of the population. But luckily enough, from what we have done, we're actually making the center of orthopedics to come to Kumi, not just in Uganda, but in East Africa or even beyond. So I cannot just do one thing. I cannot just do arthroplasty. What about the ones who get broken bones? Who will fix them? What about the ones who are born with club feet, with the other deformities? Who will fix them? So I had to make sure that I did, and I still do, train myself to make sure that I do the things the right way. I study all these fields of orthopedic surgery.
Okay.
But now that we're becoming many, we are moving to lessen our focus. I mean, there is now interest that will take. Certainly trauma cannot run away, arthroplasty cannot run away.
Okay.
Yeah.
And I kept mentioning from the beginning of the show that you founded Uganda's first orthopedic center or hospital. Talk to us about how your life is infused in the foundation of this hospital.
When I grew up as a young boy, I was born in a hospital called Ngora Hospital, which hopefully you'll visit today if you can manage. I was born in that hospital. My mother was a midwife, and in that hospital I developed an ambition as a young child to become a doctor. My mother was born with a deformity in her hip, so I was intrigued why she was walking differently from other people. And I wanted to learn how such could be corrected. And when I trained as a medical doctor at Ekure University, I developed interest in orthopedics. And I continued developing that interest when I even moved to work in a nearby hospital here called Kumi Hospital. They were flying doctors. and there were other orthopedic surgeons from Canada and from the US who used to visit on outreach programs.
Which year was that?
That was 2000, from 98 to 2001.
Okay.
And 2001, I joined the training program, the residency program at Ekure. Yes. So once I developed that interest in orthopedics and I went back to train, I came back to work in this hospital. But of course, we had a strategic difference with the managers of the hospital. And I thought I had something to fulfill for my population. So I created Kumi Orthopedic Center. And I did it not because I had money, like you said. I wasn't a millionaire then. I had to do it brick by brick. Every day, whatever I would find, I would put it down. What I had certainly was a plan of a facility that I had envisaged. Because of my extensive travel around the world, I'd seen things in South Africa, I'd seen things in the US, I'd seen some hospitals in Canada that I'd worked in. I realized that I could make something unique just for orthopedic surgery alone in Kumi.
Okay.
Yeah.
So before the professional title of Dr. John Ekure, what was the young John Ekure like?
Oh, the young John Ekure was certainly not naughty,
Okay.
but playful.
Yeah.
I loved playing football. In fact, I can't remove my shoe, but I would show you that my big toe went missing because of hitting the stones, playing banana fiber balls.
Yeah.
And we would play football day in, day out. We would even forget our assignments. But somehow, because my mother and other people would hit me that remember that you have to go to school, that's how I focused on education. But I was very playful.
Okay.
And I still enjoy playing.
Were you ever deeply entrenched into culture and traditions within the society in which you were raised?
I don't think so, but I believe I belong to the culture that I'm born into. I spent most time, I think, on the road and at school. And yes, there are certain things that I have learned now about our culture that were progressive, but there are other things about our culture that may not have been progressive. And indeed, we are transforming. We are all moving together. Yes.
Okay. From what you've told us about your self-discovery into orthopedics, does that mean for young people today that want to pursue this field of medicine, do they need to be obsessed with bones?
No, absolutely no. They don't need to be obsessed with bones, but they just need to develop interest, especially for those who have already qualified as doctors. They need to develop interest in seeing what disabilities do to people.
Okay.
And if you have a passion in turning disability into ability, in seeing people who would have gotten maimed and disabled walk again, work again, get people back to their jobs, then you'd know orthopedics is the way to go. Yes.
You mentioned that your mother had a
hip disability.
A hip disability.
Yeah.
Were you able to fix it?
No, certainly my mother died before I even became a doctor.
Talk to us about that.
My mother was a midwife here at Kumi Health Center, which is a health center just near my orthopedic center. And then, like getting to evening now, they had an evening with some of our relatives who had gathered. You know, at that time in '89, Kumi municipality was like a huge refugee camp, hosting internally displaced people from within Kumi. Because at that time we had insurgency in Kumi, we had cattle rustling in Kumi. So most of the population had moved away from the villages to the town. That's why we had the NRA, that's why we had security. So and that didn't stop people from having their evenings. So my mother went out for an evening at her relative's place, and unfortunately somebody threw a grenade at them and she died. And at that time I was in my senior 5. So there is no way I could have fixed my mother's hip when I didn't even know whether I would become a doctor, because that was shattering. That almost shattered my future. But I'm happy that the people that you see are not bad people. People have a good spirit. One old lady who used to work with my mother, called Sister Ekure, was able to take care of my siblings, 2 of them. And then I was in Tororo College in my senior 5. She was able to, together with the Kumi District Local Government, get me a scholarship that helped me go to senior 6. But again, when I came for holidays, when I stayed at her place, I met one English doctor called Dr. Richard Guinness, who actually took me up and helped me go through. And I was also lucky, and I want to thank the government of Uganda, because at that time, government was paying for those students who were bright. So when I joined Makerere University, government took over. But the other doctor now in England was able to support me with pocket money. So I never suffered at Makerere, as I suffered in the lower schools.
Yeah.
Yes.
All right. So at what point in your practice did you start to feel that what you were doing was changing people's lives?
Immediately I went to the course. In our course at that time at Makerere University, we were 5 in our intake.
5.
And you know, Mulago Hospital had 3 farms. The system then was that there were 3 farms. So we're divided into the 3. And I happened to be alone in my ward.
Oh.
And then the others were paired. I even complained that I had too much work because I was on call almost every other 2 days. I had no time for myself. It was tiring. But one of the surgeons, my teacher, told me that, you know what you're going through is training you for the future. And whenever I would see terribly injured people come and we work through the night to fix them, get them well and happy again, and they actually say thank you by coming back. They bring for you matoke, they bring for you chicken, and we never charged them money at the university as we're training. This made me feel like this was the right thing to do.
Okay.
You see a terribly injured person, terribly disabled person, but you return them to work, you get them back to their families, you get them back to their communities. That was amazing. And it has been that story. Of course, there are some times when you get depressed, when it doesn't work out well, but a majority of them are very happy with what we do.
Okay. You're still watching People and Power. It's time for Sidelines, and this episode belongs to Dr. John Ekure. So the first one is it true that because orthopedic surgeons are few in the country, it's why accident victims lose their legs, like they get amputated?
Both yes and no. Yes, because our numbers are still not matching the population of this country. We need more surgeons to train. We're a population of about 40 million people, and there are barely 100, less than 100 orthopedic surgeons in Uganda, and more than 80% in Kampala. So you can see how the whole country is naked without orthopedic services. And so when you get an accident and you don't land in the hands of an orthopedic surgeon, or you don't land in the hands of those people with the knowledge on how to handle it, you're most likely to lose your limb. But no, because many people now have the knowledge that there are places where you can actually go to and get your limb saved. I get patients coming all the way from West Nile, from southwestern Uganda, coming here because they fear their leg being cut off. So they sacrifice. They sacrifice and get that done.
So the second one is it also the same reason, because there are few, or you are few, that people resort to local bone setters? They're called bone setters. Abayunzi,
Yes.
the ones that use herbs. Nebakuyunga no.
Now let me tell you that is because of the African tradition. You'll find a professor who knows everything about orthopedics. When he breaks his bone, he even knows where Ekure or any other person, Mr. Nadumba, allocated, the hospital which could manage. But because of the belief system, they end up going to the traditional bone setters. That is something that we are fighting. It's like religion. Now, religion, you will find people that have been preached to, but they will never believe in Jesus, they will never believe in Muhammad, but they have heard the message before. That is just about the way we Africans think. So we are trying our best to educate people, to make sure that they understand that the traditional bone setters are only making a lie. They are telling a lie. Absolutely. Those bones will heal whether you treat them or you don't, but how they heal is the problem. Okay? So in orthopedic surgery, we make it heal the way God created it. But the other ones, we will keep massaging, and sometimes they make it worse.
We're going to return to exactly that after a short break. You're still watching People and Power. Do not forget to download the Afro mobile app, either on SOS or on Android. And of course, you can be able to watch this episode of People and Power that belongs to Dr. John Ekure on the NBS channel.